This is a video demonstrating a rotator cuff repair with Dynacord Suture, Healix Advanced Knotless Anchor with percutaneous fixation of a proximal humerus fracture with Tactoset. Hi everybody, Dr. Scott Sigmund. We're going to go over an interesting case here. This is a 65-year-old woman who had a slip and fall about 2 months ago and has been treated conservatively and had persistent pain and discomfort, and this MRI was obtained that you can see here. What's interesting is she has a full thickness tear, but she's also got significant edema into the proximal humerus. And this is almost an insufficiency fracture that we see, and it's really also one of the major sources of pain associated with these patients. It's not just the rotator cuff tear. In addition, you wind up, if you're trying to put an anchor into this zone, you can wind up not getting very good purchase. So what we've elected to do for this patient in particular is we're going to bring her to the operating room. We're going to use Tactoset, which is a bone mineral substitute, which will inject directly into the zone of the insufficiency fracture. That will do two things. First, it's going to give significant pain relief to her from the fracture site itself. And second, it's going to increase our purchase for the anchor. And what's really cool is we can actually use the hole that was drilled for the Tactoset to go in as the hole in which we're also going to place our anchor. So we're going to move over next and be able to show you some intraoperative views of the Tactoset going in as well as the repair itself. Peace out. So here we are in the operating room. We've already mixed our Tactoset on the back table. We're about 10 minutes into the mixing time at this point. Operating room is a temperature of about 67 degrees. We've had a good experience with handling time out to about 30 minutes at this temperature, so there's no concern about the fact that the Tactoset will harden too fast. You can see here we've actually already placed our cannula in appropriate position. The rotator cuff tear is off to the right. That's a relatively small 2 centimeters supraspinatus tear off the footprint. We now are injecting our second syringe filled with Tactoset, so we're going to lay in about 2 to 3 cc's here, feeling quite comfortably based on the volume that we identified on the MRI scan. In addition, this is arthroscopically assisted. It's a direct visualization of the cannula. I don't feel compelled to use a C-arm for visualization, although you certainly could. You can see here there's some slight extravasation of material. Not overly concerned. It's an aquaphilic material. It's just calcium and phosphate, easily washed out with your shaver once the material's in. What's interesting is I placed the cannula right in the zone of the footprint where the fracture was, but also where we're going to wind up being able to put our anchor. So this is going to solidify the purchase zone of the anchor, also going to help with the patient's pain associated with the insufficiency fracture itself. At this point now, we're sort of reversing our cannula out. You can see here we're just going to push a little bit more at the end just to sort of fill that last little gap. We'll go ahead and surgically shave out the remaining tissue. What's great about the Tactoset, it has an X-ray diffraction pattern very similar to the natural crystalline structure of bone, so recognized by bone as well. So you can see here, there's the footprint. We're putting our shaver in here just to clean out any of the loose Tactoset material, and then cleaning the bursa, and you can see quite clearly where our zone is. It's going to be the perfect placement for our anchor. So next what we'll do is we'll work into the actual rotator cuff repair. We're going to do our rotator cuff repair with Dynacord Suture, which is a MyTech suture, which is quite fascinating. If there's laxity in your construct, the internal structure of the suture has silicone, which allows for basically a shrinkage effect. So there's a longitudinal shrinkage across the suture, which maintains pressure across the footprint. Really quite fascinating. This is a Healix Advanced Knotless Anchor made out of BioAcryl Rapide. You can see here we're going to just sort of mallet this anchor down to the exact same hole that we placed our Tactoset. The Tactoset here is going to do two things: increase the purchase for the anchor, as we stated, but also reduce the pain. What's great, you can see here as I'm twisting in our anchor, we're really getting very nice feedback, tactile feedback about the purchase of the anchor into the bone, which, had we not used the Tactoset, this is osteoporotic bone with a fracture, and our purchase could have been suspect. So super happy with the way in which this anchor goes in. We'll then just go ahead and back out the sutures. We'll make our suture cut here as well, and we've essentially completed our rotator cuff repair, helping this patient both with pain and function, and will allow early range of motion for this patient.